Your doctor mentioned knee replacement. Here's what the operation actually involves, and what recovery really looks like. The knee is where the thigh bone meets the shin bone. Smooth cartilage lets them glide against each other. When cartilage wears away, usually from arthritis, bone rubs on bone. That causes pain, stiffness, and swelling. Surgery is usually considered when pain limits walking, sleeping, or stairs, and non-surgical treatments no longer help. Surgeons resurface the worn joint. Damaged cartilage and a thin layer of bone are removed from the femur and tibia. Metal caps fit over the bone ends. A smooth plastic spacer sits between them, recreating a gliding joint. Total replacement resurfaces the whole joint. Partial replacement resurfaces just one worn side, keeping healthy parts intact. Most people stand and take a few steps the same day or the day after surgery, with help from a physiotherapist. The first 2 weeks are the hardest. Swelling, exercises, and disrupted sleep are normal. Ice and elevation help. By around 6 weeks, many walk without aids on flat ground. Strength keeps building over 3 to 6 months. Like any major surgery, there are risks: infection, blood clots, stiffness, and rarely ongoing pain or implant problems. Modern implants often last 15 to 20 years or longer. Lower impact activities help protect them over time. Did you know? You can get this treatment abroad at the same quality you'd get in the US or Europe, for a fraction of the cost.
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.